Okay, so hopefully you got my email, and we are moving on to, if I go down your, um, sorry, if you go down on your, this is the front of your Moodle page, and we're going to start on protozoal vector-borne diseases and zoonoses. So I put some notes. The first one is the homework sheet, but that won't be due until Monday. And then I put some notes on tick-borne diseases, Giardia, and coccidiosis, because Giardia and coccidiosis, and we also, I have to add some more notes. I was modifying a few different handouts. Toxoplasmosis, and also, oh my gosh, I'm blanking on the other one I was needing to add on to here. So we're going to go over the ones that are protozoal, which, when we talk about protozoal diseases, they're kind of under the classification of intestinal parasites, except they're not a worm. And so what we're looking for on a fecal is an actual protozoa, or, a single cell. I don't know, did you talk about coccidia or giardia in Animal Tech 2 when you did that? So probably briefly, because they usually come up under when you talk about intestinal parasites. So you probably, some of that will probably be review, but we'll go over that. And then and then cat scratch fever, which, so I put, there's a good PDF here that goes through it, which, what is cat scratch disease, because again, after cat scratches, and then something that we get infected with, that is considered a zoonotic disease. So, just as a review, if something is zoonotic, it's something that we can pick up. And can I ask another question? Have you guys talked about heartworm disease when you talked about parasites? I'm assuming, okay, good. Because part of this section, when we talk about vector-borne diseases, is we're going to talk about, and again, I have a few more handouts to put on here. So, but we're going to talk about, blood-borne parasites like mycoplasma, babesia, and obviously heartworm disease. When you think about a vector, it's something that's carrying the disease and usually spreads it via a tick bite, a mosquito bite, and again, some of that is going to, be found in the blood. So we're going to actually look on a blood test to look for evidence of these blood-borne parasites. So even though you've done parasitology, some of this is going to cause systemic illnesses. And if I actually, sorry, I got crazy boys here today. Sorry, I'm actually looking for, did you guys, it's not showing me that I sent an email. Did you get my email with the reading assignments? Because normally I get an email copy back to me. Okay, because it's not pulling up. So I can add it to Moodle, or I can put a little note here. But in your common disease book, unfortunately, a lot of this is covering maybe a few pages in this chapter. So I didn't really put chapters, because this isn't all in one chapter. It's maybe a page or two in this section. There's a page or two in this section. And I don't have a copy of your most current McKiernan, that giant book. I know you guys sometimes don't use it a lot, but there's also potentially going to be some information in there. So my McKiernan I have here is too old, so I need to get a copy at school, and there, there's going to be some reading in there. So the reading will jump around, and unfortunately this book doesn't give a lot of details, but I'm gonna kind of start with the tick-borne diseases for now. And let me go ahead and pull this up. Now, again, you may have gone over, some of this is review. Maybe you've talked about little blurbs here and there in class, but let me pull it up over here and get it bigger. But when we talk about tick-borne diseases, and we generally talk about them as what species of ticks, because there's all different kinds of ticks. You've probably seen picture, and I need to put in some pictures, but there's all different. You have the tiny little ticks, bigger ticks, but the Ixodes species, and there's different, you know, subtypes under there, but the Ixodes ticks are the ones that typically transmit. And probably the most common one that comes to mind is Lyme disease, which is actually Borrelia burgdorferi. These are lots of fun words to pronounce. But one thing that's interesting about Lyme's disease is that the tick needs to be on for at least 24 to 48 hours. So say, for example, you take your dog out for a walk, you come in and you feel a tick, and it's maybe been on, for an hour. There's a much lower chance that your dog is actually going to get Lyme's disease if it's been on for a very short period of time. So that's why, and normally if people like walk their dog in their neighborhood, one thing that ticks do, and you may have, like, again, talked about this a little bit, is if you think about tall grasses, and what's funny is they kind of hold on, and then the other part of their legs are like sticking out. So as your dog walks through, or even people, as they walk through the grass, the tick kind of latches on, and then ticks like to go north. So on people, if you are out hiking, they always tell you to check, obviously, especially in the back of your ears, or to check your hair, because generally they like to travel up to the top of the animal. That's why if you look at animals that have ticks, and yes, you can find them anywhere, but especially like in the crevices behind their ear, in their little folds, sometimes around the eyes. Those are the areas that you really want to check. And again, if you're walking in the woods or areas in fields that have taller grasses, those are where we tend to see ticks. So, if you're just going to a basic park with cut grass, there's a lower likelihood of getting ticks on your animals. So that's important when you take the history, is like, where do they walk this dog? Where do they spend their time? But if they're out in the woods, we definitely had to check for ticks. In the northeastern part of the United States has a higher prevalence of Lyme disease. So again, and we're not necessarily northeast, but I would say, we're kind of in that region. Now, Lyme's disease has different phases. There is the acute phase and there's the chronic phase, because you might discover this later on. There is a chance you have dogs that are like German Shepherds or Akitas, or they've got, a Husky, and they've got a thicker coat. Sometimes it's harder to see these ticks, but a tick is basically going to bite. And if you've seen pictures, and they fill up with blood, and they kind of look like a plump little grape-like thing, and then they fall off. So there is a chance that maybe the owner never saw a tick on their animal. And sometimes it's hard, like in people, they tell you to look for like a target-like wound. So, they bite and there tends to be a red circle around it. Well, unless they bite a dog on the abdomen where they don't have a lot of hair, sometimes it's hard to see where there was a bite. So there is a chance they could bite, fill up, fall off, and the owner never recognizes that they did have a tick. But what we look for in Lyme's disease, in the acute phase, they could be having a fever, but one of the main clinical signs is a shifting leg lameness. So normally if a dog hurts, like say a cruciate ligament, they are limping on one leg consistently. You know, maybe it's their back right leg, and that is the leg that is predominantly affected. But if all of a sudden they're limping on the right rear leg, then the left rear leg, then the front right leg, you know, it'd be rare that a lameness would travel to multiple limbs. Normally, if it's musculoskeletal, if it's arthritis, a cruciate, you know, something wrong, you know, it's typically in one leg. But when they're diffusely lame, then we're talking about something that's affecting them systemically, not localized. And that's the difference. They can have swollen joints because this does attack their joints. So they might notice a swelling, and that doesn't mean that's where they were bit. That just means that's one of, you know, it's affecting the limbs, and maybe they're tender, like around their carpus or their stifle. Those are the prominent, you know, or the tarsus, probably the stifle, the tarsus, and the carpus. Now it can affect the shoulder or the elbow too. And maybe they're just tender. You might also notice enlarged lymph nodes. So I don't know if you guys have talked about, I kind of couldn't get to that lecture in anatomy, but if you, I don't know if you've talked yet about lymph node locations. Can you shoot me out some lymph node locations? Where would I find, what lymph nodes am I talking about? Axillary, so that's in the armpit. Submandibular, so under the jaw, exactly. Prescapular, perfect. Lingual, or inguinal, sorry, because I was like, lingual, there is one there, but that, yeah, so inguinal. And then the one caudal to the stifle, behind the stifle, kind of where they're behind their, well, I never really say knee in animals, but behind their stifle where their leg kind of indents, they have the popliteal lymph node. And those are the ones that are palpable. You know, there's lymph nodes throughout the entire body. There's lymph nodes everywhere. But when I say where is a palpable lymph node, you guys have all, you know, submandibular, the prescapular, and the harder ones to feel are the axial and the inguinal. But if they're enlarged enough, you will sometimes see swelling, or sometimes their leg, you know, their armpit, they're kind of like sticking out their limb. And then they can be lethargic, depressed, and maybe anorexic, you know, and this is the hard part in animals. You know, lethargy, depression, anorexia can be symptoms of about 100 different diseases. But where Lyme's disease starts to narrow is the lymph nodes, the lameness. And the reason they're lame is their joints hurt. They just hurt kind of all over in their joints. And then, you know, fever. And let me mention, I've sometimes had to counsel, you know, owners over the phone when I've worked in ER. I belong to this boxer group on Facebook, and sometimes people will reach out about things. And, you know, an owner should invest in a digital thermometer. They can use a, you know, get it at Walgreens, whatever. And, you know, they may have to get some lube. I mean, I had to take, AJ actually didn't have like full heat stroke, but he went on a long walk Saturday with my son. He came back really panting, and I took his rectal temp, and he was 104 degrees. It was kind of hot on Saturday. I think they ran and they kind of went too far. And when he came home, you know, I had to take a rectal temp. And sometimes owners might be reluctant because they're like, where do I have to put that? But that's the most accurate location. Sometimes you can put it in their armpit and get it way up in the armpit and kind of close their leg. But if they really need to know a temp, and anything above 102.5 is abnormal temperature. So, you know, you may have to talk an owner through it. Now, if it's chronic, then they're going to have what's called polyarthritis. And poly just means arthritis in more locations, because the inflammation in the joint just becomes a chronic condition, chronic inflammation. And anytime you have inflammation in a joint, if you remember, joint fluid is supposed to be viscous or sticky, but inflammation creates fluid in the joint. It dilutes out that sticky joint fluid. And then what happens is it's not a lubricating fluid anymore. And what happens is the bones, then tend to rub on one another, and that causes more inflammation, and then that causes pain, and then that causes lameness. So it's just kind of like a cascading effect, and you get joint changes because what happens is if the joints are chronically inflamed and you get rubbing on the bone, you create something called osteophytes. And osteophytes form on the ends of bones that rub together. And it's basically like the bones, it's almost like, I don't want to say like bone spurs, because sometimes people talk about people getting those in their feet, but they're sharp edges and they rub and they cause a lot of pain. So again, it just kind of cascades and it causes these joint changes, and eventually in some cases can cause renal failure if this infection could go on too long. Now, it is a difficult diagnosis. This is frustrating to owners because, you know, most of the time if they come in and they say, well, they hurt, they're depressed, they have a fever, you're going to start off with a basic CBC Chem UA. But a lot of times those results are going to come back normal because initially, unless it's progressed to renal failure stage, in the early stages, you know, maybe an elevated white count, but potentially. But a lot of times the initial results are abnormal. Now, sometimes the doctor, and this is what happens, sometimes an owner doesn't want to spend a lot of money. The blood work comes back normal. The doctor might suspect Lyme's disease and try a round of antibiotics. And when they do antibiotics, the lameness gets better because this infection, this Lyme's disease, goes to the joint. We give the antibiotics, it clears up the infection. So it can get an improvement with antibiotics. Now, there is an ELISA and test for it. It's a SNAP test that you can do in the clinic. The problem with ELISA tests is if the animal, so I don't know, Lyme's disease is a vaccine. It's not a core vaccine. So not everybody needs to get a Lyme's vaccine. Like if you're a person that goes hiking and camping and you take your dog out in the woods, probably not a bad idea to give them the Lyme's vaccine. But if they've had the vaccine, it can cause a false positive. So if the dog has a history of vaccine, then you're going to have to maybe do what's called a Western blot test. And this is a special test done at the lab. And this can tell the difference between an active infection versus a vaccine. And again, vaccines aren't 100%. In theory, if they're vaccinated against Lyme's disease and they do get bit by a tick, they shouldn't get it. But you always run the risk that the vaccine was given wrong, it was stored improperly. Interesting, I'll tell you a side note about the vaccine. My dog actually, I gave Bo a lot. I live by woods. Now, we don't walk a ton in the woods, but we do some. And he got sick. Like he vomited 5 or 6 times in a row, came home, and we think he had maybe a reaction to, now he didn't swell up or get poofy. It wasn't like an anaphylactic reaction, but there are some dogs that have gotten sick after the vaccine. Now, if I wanted to get him a vaccine, a booster, I was talking with Dr. Ritz, we'd probably give him Benadryl or something like an hour before his vaccine to just see if that would help him not react. So you can have seen some of that. Now, the treatment for Lyme's disease is actually antibiotics because it is, basically this bacterial agent. So it does respond to, and the treatment of choice is doxycycline. Now, doxycycline, you'll hear me talk about that when we talk about blood-borne parasites, when we talk about like mycoplasma and stuff. So doxycycline, it's a pretty strong antibiotic. It needs to be given twice a day. Now, you guys are probably in Farm 1, so you've probably not talked about antibiotics yet. I was gonna say, does anyone know why you don't use doxycycline in young puppies or young kittens? And it affects the enamel. So doxycycline in young animals can affect the enamel. Um, and when they're getting their adult teeth and they're building their adult teeth, it can affect and give the tooth like that grayish color and maybe make it more permeable. So generally, if they're, I would say if they're under 6 months of age, and I'd have to double check this age to be, I would just say on a test, I want you to know is you don't want to use doxycycline in younger animals. You can try amoxicillin. So if they're, 6 months or younger, instead of doxycycline, you might want to try a different antibiotic. But doxycycline, I do want you to know, is the gold standard antibiotic. And it's potentially going to be at 3 weeks treatment minimum. Sometimes it has to be repeated. So it's not like a given 5 days and it's gone. This is usually treated for several weeks. Now, obviously, any time that we talk about, um, ticks, obviously it's better to approach this from a preventative standpoint. You can do tick preventatives and obviously some flea and tick preventatives. And I know, they're constantly coming out with new ones. I know this Vectra 3D was supposed to, or I'm sorry, that's the vaccine, but the Advantix Frontline, there's also a collar that's supposed to be good for ticks. And of course, I'm forgetting the name of the collar. It's but there are, if they're going to spend, again, it's Seresto. That sounds familiar. You can tell it's Monday and I'm back from vacation. Yes. So the Seresto collar, there's just some things that, and again, does every dog need to do this? Probably not. But again, if you have people that go camping and hiking or hunting with their dog, those dogs, those people need to invest in, or getting the lymes vaccine and doing around. And again, most of the time they go in for standard vaccines. Some vets don't even, I've worked with doctors that didn't even offer it. It was kind of like if the owner asked. So we didn't give, this vaccine routinely, and if your dog, if you live in an inner city and they're an apartment dog or you're just going to the local park, maybe they don't truly need it. We generally try to not vaccinate for things that we don't think they're really going to need as a routine practice. Now, in human clinical signs, because, this is something that people can get, you know, what people tend to see is this bullseye lesion where the tick bit. And again, they maybe didn't notice the tick, but all of a sudden they itch and they look and they see this target bullseye bite. And that's kind of very classic for tick bites. And sometimes they will get a rash near that area of the bullseye bite. So it can go from a rash, and then it typically progresses to the flu-like symptoms. You're just tired and achy because, again, if it's affecting, a lot of times when you have the flu or you have a fever, you just feel achy. And, when you get into 3 days up to 6 weeks later, now what we worry about, cardiac complications and encephalitis is now encephalitis is swelling in the brain. So that would, it can progress to that. It can affect the cardiovascular system, but probably the number one thing that people complain about is the musculoskeletal pain. Everything just hurts. And again, it's not hurting in one spot, like just my left elbow. It's kind of like all of your joints and your muscles just feel, just even to the touch, you're sore, or all of your joints hurt when you walk. So it again, it causes this diffuse skeletal joint pain, and eventually it can move on to, CNS disturbances, in your central nervous system. Arthritis is a big one, rashes, dermatological conditions. So, again, you need to think about where we're at with, are the people out hiking with the dog? Are they walking with the dog? And things like that. Let me see if I can, hold on. I think I have to close that for a second, but I want to show you, see if I can get this to pull up. Now, here's the flea and tick spot treatment. So I was saying vaccine, and I was like, wait, the vaccine, that's not right. So this is the Vectra 3D, and if we click on it here, it kills and repels fleas, ticks, and mosquitoes. So a product like Vectra could be used. Let me, okay. And here is, hopefully you guys can see this picture. So here is kind of that bullseye. You can see you got the bite in the middle, you've got the red circle around it, and oh, look at this poor dog. But do you see what I mean? Like when ticks travel on the animal, they tend to, when we say they tend to go north, and they tend to follow up. And so they're always going to be kind of congregated generally around the head and the ears. And here's the very classic. This tick has obviously been feeding for a while, very filled with blood. And there's some tick bite welts. You can see there's that target pattern. And a lot of times an owner might see this and think, oh, they got bit by a spider, and potentially, but the spider bite doesn't tend to cause this red ring. And that's the difference in the tick versus being bit by something else. And so a good preventive, and let me try to find that picture here, one. And here is what that collar looks like. So we talked about the Seresto, so it comes in a tin like this. And we've got fleas and ticks. And, you can see that it's put on here, and they last, I want to say, about 6 months. I've never used it yet for my pets, and it's like a newer treatment. So obviously anytime you use like a collar, we worry about that. And here's a few of the different, so this is a Borrelia burgdorferi vaccine, can be given up to as soon as they're 9 weeks. A lot of times we were, there may have been some stuff about it. Anytime these new, I haven't heard the new scuffle about it, about the Seresto collars. I thought I had read people thought they were pretty effective. But here is just what the vaccine would look like. And 1 ml sub-Q, a booster in 2 to 3 weeks, and then usually this is given yearly. if the owner, requests it. I was trying to find another picture of the rash. Well, here's a nice little congregation of ticks. So again, this one, you can see the redness in the middle where it's bit, comes off, leaves that red ring. And the other thing that, since we're talking about it, and I want to mention this because I'm sure you guys have already gotten this, your family and friends, you're in vet tech school, so they're like, oh my gosh, I have found a tick on my dog. What's very important when you go to remove a tick, and you can do it, obviously if you have like grabbers is ideal, like tweezers or like some pinchers of some kind. You can use your fingernail, but you want to try to grab at the head, because what's important is if you grab back here, a lot of people grab the belly of the tick, and you can separate it, and then the head and the teeth remain in the skin. And the problem is, it does still have saliva in it, so that can leave back saliva, but sometimes it can also get infected if you leave like the parts behind. So ideally, if you're going to remove a tick, some type of little pinchers, and you want to grab as close to the skin, as close to the head as possible. Now, I have heard all kinds of wives' tale about put a match on it. Well, I don't really want to tell people put a match near your dog and set it on fire. I've seen people blow out the match and then try to touch the tick to burn it to release. I mean, yes, that could potentially work. Ideally, it's best to pinch it off and grab it at the head. Just don't want to grab it at the body. You want to try to get, it's best to see if you get the teeth out. Now, when you remove them, what we usually do is we kept a little cup of alcohol and we put them in the alcohol, or you can tell owners, put some alcohol on like a napkin and put it in there, because if you just put it in the trash and it's still alive, could it theoretically crawl back out of the trash? Yeah, I mean, I want to make sure it's dead, so we usually put it in some alcohol and make sure that the tick is dead, and we don't just like throw it on the ground. Things like that. But I mean, you can see they can get really buried in the skin. You just have to be careful. I was trying to show. And what we can see now, here's some pictures in people. There, look at that. See this? Hopefully you're seeing all this target pattern. Yeah, if you put it in like a dish of water, drown it, a little bit of rubbing alcohol, crush it. I know we don't want to hear crunching and everything, but you can see these different types of bullseye rashes and can get rashes around it. And again, you always want to look especially near the base of the neck, the base of the hair. They like to go north. And again, they can bite really anywhere, but they tend to gravitate north. Here's one. I'm trying to see if they have a picture. It's hard sometimes to get pictures of just joint swelling. But generally, if you have a dog that is reluctant to do activity, that you can kind of push on the joint, it shouldn't really feel squishy. I know that's a very technical term, but if it feels swollen or plump or tender or hot, because generally if the joints are inflamed, here's a good picture of using these grabbers, like some kind of like, there's a you know, you haven't gotten into your surgical instruments yet, but there is a, they're basically called hemostatic forceps or hemostats. And most clinics, we have them in the drawer just to help grab things. That's what we can use a lot. We just use some, I've heard some ticks can grow another body. If, you know, I would have to look that up, Jamie, to be, sorry, I went past your question. I just saw it now. That's a really good question. I mean, the thing I mostly, if they left a little bit of the body behind, I don't think it would be like, they wouldn't, it would take too long for them to grow a whole new body. But theoretically, if somebody ripped just a part of the body and maybe left a little bit of the body behind and it grew from that, because it would have to stay alive in the skin. And generally they're on, you know, for about 24 to 48 hours. So they don't typically stay much longer than that. But I would have to do some research on that, to be honest. But that's a good question. I would worry more that someone just didn't get all of the, when they grabbed it, maybe they left a little bit of enough of the body behind that it sealed off and filled. Theoretically, I could see that. So hopefully that answers your question. I'd have to do a little bit of research on that. So, oh, and the other thing is, you know, now it's kind of looking on here, maybe this is the prepuce, checking there, you know, these extra folds, spreading the skin, because again, they will vary in size, and some are definitely going to be easier to see. But again, this target bullseye pattern is the most common. So what I think I will do, because we have about 10 minutes before I get into the next section on there. Does anyone have any other questions about Lyme's disease? One thing that happened, and let me mention this, because we're worried about the bacteria, once they spread the Borrelia and Borrelia enters into the body, again, we worry about the bacteria getting into the joints and causing inflammation. You worry about it getting into the brain. But if it does, when bacteria enter the heart, so where some of the cardiovascular problems come from, it's not causing heart disease, so to speak. But whenever an animal has a bacterial infection, bacteria like to lodge into like heart valves. And when they attack the valves of the heart, they can cause inflammation, and that can affect the way the valves open in the heart, which can in turn affect circulation. Because anytime someone, if you've ever heard the term endocarditis, anytime, like we worry about dogs that have really crummy teeth because that bacteria gets in the bloodstream and it can lodge in the heart, and it can cause endocarditis is an inflammation of the heart. So it can inflame the muscle, but it can, you know, attack the valves and cause an inflammation of the valves. And if they're inflamed and swollen and they're not opening properly, that affects circulation. If the muscle is inflamed, that can affect contractility, and, you know, so the heart problems, again, aren't maybe going to be in the acute phase, but if there is an infection that goes undetected, we worry about those longer term symptoms. Okay, well, I will be adding some more information because there's a few other things about the toxo and that I have to put on there. So we'll keep looking back to this, but we'll just pick up where we left tomorrow, and I will post this video. And if you have any questions, again, your email shows the reading. I'll probably find some more good art. If I find a good article, I'll probably post some. I like Merck. Vet Manual has a lot of good resources. So I'll try to put some information. If not, welcome back. And I will see you guys tomorrow. Thank you. Have a good day. Bye.